Welcome to the third quarter 2024 Indiana FADS education webinar on home health services. This webinar is designed to provide billing and rendering providers with comprehensive training on the documentation requirements for home health services. The goal is to ensure that all Medicaid claims submissions are fully supported and adequately documented. This webinar is being sponsored by the Office of Medicaid Policy and Planning, or OMPP, with contributions from Lisa Copsey and Kelsey Oren. By the end of this webinar, you should be able to review the IHCP rendering provider medical record documentation requirements, define home health services, describe key IHCP and CMS regulations for home health documentation requirements, and review common home health service documentation errors. Let's start by reviewing the IHCP documentation.
As IHCP providers, you have agreed to comply with the documentation requirements written in the IHCP Rendering Provider Agreement and Attestation Form. Let's review the documentation requirements outlined in this form. Billing providers have specific responsibilities when they accept reimbursement from the Medicaid program. They must be sure that the claims submitted are true and accurate, and that the medical record documentation supports and justifies the billed services. Medical record documents in support of the claim are subject to review by various parties, including employers, federal and state reviewers, and auditors. The Office of Medicaid Policy and Planning Program Integrity section conduct reviews designed to ensure that federal and state taxpayer dollars are utilized effectively in delivering high-quality and essential care while also preventing fraud, waste, and abuse. High-quality medical billing documentation is essential for several reasons. It serves as a legal document that verifies the services provided, the reasons for those services, and the necessity of the patient's visits to the provider. This documentation can be crucial if used as evidence in a court of law. Professional documentation facilitates effective communication of the treatment or care plan and clinical reasoning to other healthcare providers, ensuring continuity and clarity in patient care. And for billing purposes, thorough and accurate documentation provides a solid foundation for the rendered services and ensures compliance with regulatory standards. Now, let's review the IHCP Rendering Provider Agreement and Attestation Form. As a rendering provider, you have agreed to the requirements in the IHCP Rendering Provider Agreement and Attestation Form. Specifically, you have agreed to abide by and complied with all of the stipulations, conditions, and terms set forth within the agreement. Further, you agree to abide by all federal and state Medicaid laws and regulations, including applicable IHCP bulletins and banner pages. Violations of any of these could result in administrative sanctions, criminal, or civil penalties. Several sections of the IHCP Rendering Provider Agreement concerns medical record documentation requirements. Let's examine the agreement's terms related to medical records and documentation, and how they relate to the billing requirements for the rendering of home health services. In Section 11, providers agree to abide by the state's Medical Policy Manual and IHCP Provider Reference Modules as amended from time to time, as well as all provider bulletins, banner pages, and notices. Any amendments to the policy manual or reference modules, including provider bulletins, banner pages, and notices, will be communicated on the official state Medicaid website and will be binding when made public. Section 24 states that providers agree to fully cooperate with federal and state officials and their agents as they conduct periodic inspections, reviews, and audits. In Section 25, providers agree to make available on demand by federal and state officials and their agents all records and information necessary to assure the appropriateness of IHCP payments made to providers. This assures the proper administration of the IHCP and assures providers' compliance with all applicable statutes and regulations. These records and information are specified in 405 Indiana Administrative Code 1 through 5 and in the policy manual, reference modules, bulletins, and banner pages. Section 25 also includes a list of the records that should be included, though this is not a complete list of possible records that may be required. Medical records, as specified by Title 42, U.S. Code 1396A, number 27, and any amendments. Records of all treatments, drugs, and services that the vendor payments have been made or are to be made under Title 19 or Title 21 programs, including the authority for and the date of administration of the treatments, drugs, or services. Any records determined by FSSA or its representative to be necessary to fully disclose and document each set of services provided to individuals receiving assistance under the provisions of the IHCP. Documentation in each patient's record enables the FSSA or its agent to verify that each charge is due and proper. All other records found necessary by the FSSA or its agent in determining compliance with any federal or state law, rule, or regulation communicated by the U.S. Department of Health and Human Services or by the FSSA, and any other information regarding payments claimed by the provider for furnishing services to the plan. Now that we have reviewed the rendering provider agreement, you may be asking, what can I do as a rendering provider to ensure I'm following these requirements? The OMPP policies emphasize 4 key areas to ensure compliance with complete and accurate documentation. Providers should thoroughly document every patient encounter. This documentation is crucial, as it serves as a primary means of communicating essential patient information. Incomplete or inaccurate records can lead to unintended and potentially dangerous outcomes for patients. Also, precise documentation is vital for adhering to federal and state laws, and it plays a significant role in minimizing fraud, waste, and abuse. The OMPP Provider Integrity section offers the following best practices based on findings and issues identified in previous audits as follows. Make sure that each patient encounter is documented completely, legibly, and timely. Make sure the documentation clearly identifies the rendering provider and/or rendering provider employees. Make sure the documentation is signed and dated. And make sure the documentation includes details of physician involvement. Additional service-specific documentation requirements are detailed in the IHCP Provider Reference Modules, as well as in the IHCP Provider Bulletins and Banner Pages, the IAC, and statutes. Providers can use the following links to visit the Provider References page for more information. For historical purposes, bulletins issued before 2020 are accessible from the archived bulletins.
In this section, we will define home health services and review the types of home health services covered by Medicaid. In accordance with the Code of Federal Regulations, the IHCP defines home health services as services provided on a part-time and intermittent basis to Medicaid members of any age in the member's place of residence. Members may receive home health services in any setting in which normal life activities take place other than a hospital, nursing facility, or any setting in which payment is or could be made under Medicaid for inpatient services that include room and board. Home health services cannot be limited to members who are homebound. These services can be medical and non-medical care to individuals in their own homes, often for those with chronic conditions. The services provided can range from personal care to physical therapy. Let's take a look at the different types of home health services. There are two different home health service types, waiver and non-waiver. The term waiver refers to waiving of certain federal requirements that otherwise apply to Medicaid program services. Section 1915C of the Social Security Act permits states to offer, under a waiver of statutory requirements, an array of home and community-based services, or HCBS, that an individual needs to avoid institutionalization. This is designed to offer more flexibility in how states use Medicaid funds, enabling them to tailor services to meet the needs of individuals who would otherwise require institutional care. The services covered can include personal care, case management, home modifications, respite care, and other support services that help individuals live independently at home. In contrast, home health services requiring prior authorization means that the healthcare provider must obtain approval from the Medicaid program before providing certain home health services. This ensures that these services are medically necessary and meet specific criteria which is set by the insurer or Medicaid program. The healthcare provider submits a request for approval, including documentation of medical necessity. Medicaid reviews the request and either approves, denies, or requests more information. Services could include skilled nursing care, physical therapy, occupational therapy, and certain medical equipment or supplies provided in the home. Now we'll take a look at the covered and non-covered home health services. As a provider, it's important for you to know whether home health services are covered or not, and which providers can render services to IHCP members. Home health services are available to IHCP members of any age when the services are medically necessary in order for the member to continue living in their home, ordered in writing by a licensed practitioner such as a physician, nurse practitioner, clinical nurse specialist, or physician assistant, and performed on a part-time and intermittent basis in accordance with a written plan of treatment or plan of care. Let's look at the covered services and practitioners and also the non-covered services. Medicaid home health services cover a wide range of benefits. However, it's important to note that not all home health services are covered by Medicaid. The home health services that are covered under Medicaid include skilled nursing, home health aid services, and skilled therapies such as physical therapy, occupational therapy, and speech-language pathology. IHCP home health benefits include covered services performed by registered nurses, licensed practical nurses, home health aides, physical therapists, occupational therapists, and speech-language pathologists. The following services are not covered under the home health service benefit, but may be considered under the home and community-based waiver services. Transporting the member to grocery stores, pharmacies, or banks. Homemaker services, including shopping, laundry, cleaning, and meal preparation. Chores, including picking up prescriptions and running other errands. Sitter or companion services, including activity planning and escorting the member to events. And respite care. The next important thing to understand as billing and rendering providers are the IHCP and CMS regulations for home health documentation requirements. IHCP and CMS have created guidelines to help providers understand the regulations associated with home health services. This section reviews these key regulations. Let's take a look at some key IHCP and CMS regulations for home health documentation requirements. Keep in mind that this is not an all-inclusive list. To learn more, visit the links here or on the IHCP's website. Face-to-face documentation. as documented in 42 CFR 440.70, Section F. For the initiation of home health services, the face-to-face encounter must be related to the beneficiary's primary reason for requiring the face-to-face visit and must occur within 90 days before or within 30 days after the start of services. Initial order for services. IHCP Provider Reference Module Home Health Services states that home health services are available to IHCP members of any age when the services are ordered in writing by a qualified practitioner for the service to be performed. Home health services that are part of the medical necessity criteria and utilization management policies that follow the non-customized national clinical guidelines, either Interqual or Milliman Care guidelines. Home health services prior authorizations. Indiana Administrative Code 405 IAC 5 through 16, Section 3 outlines that all home health services require prior authorizations, except as outlined in the PA exception for hospital discharge section of the Home Health Services Provider Reference Manual. To learn more about obtaining a PA for home health services, see the IHCP Provider Reference Modules. Plan of Treatment or Plan of Care. In accordance with the IHCP Provider Reference Module, Home Health Services requires that a written plan of treatment developed by the qualified treating practitioner, home health agency personnel, and if applicable, therapists, is required. The plan of treatment must be signed by the qualified treating practitioner and current through the date of request. The documentation must also include the information listed here. Now let's take a look at a few additional home health documentation regulations. Visit Notes. In accordance with 405 IAC 5-22-2 and 405 IAC 1-1.4-2 Medical Records, Section 2, Medicaid reimbursement is available for services rendered by registered nurses, licensed practical nurses, and home health agencies. Visit notes for services must include the following: the identity of the individual to whom service was rendered, the identity including the signature or initials of the provider rendering the service, the identity including dated signature or initials and position of the provider employee rendering the service, the date on which the service was rendered, and a statement describing services rendered, including duration of services rendered, for example, the time in and time out. Refer to the IHCP Provider Reference Module, Provider and Member Utilization Review for documentation requirements. Record retention. IHCP Provider Reference Module, Provider and Member Utilization Review, Medical and Financial Record Retention, and 405 IAC 1-1.4-2 Medical Records, Section 2, outlines that all IHCP providers shall maintain for a period of 7 years from the date Medicaid services are provided to a member such medical or other records as are necessary to fully disclose and document the extent of the services provided.
The OMPP identifies common errors during the post-payment audit process. Clinical reviewers make their determinations, known as audit findings. Then these outcomes are communicated to the rendering and billing providers. In this section, we will look at the review process from the clinical reviewer's perspective and present the common documentation and process errors that are detected. To ensure a smooth and efficient review process, please follow these instructions when preparing your documentation. By adhering to these guidelines, you can help expedite the review process and minimize any potential delays or denials. When gathering your documentation to submit to IHCP for review of medical records, please ensure that all documents are combined into a single PDF file for each requested member. Label each PDF using a consistent title for each member including the audit case ID number and the member's name. Here is an example of how the PDF file should be named. To ensure a streamlined review process within the file, please ensure that the documents are submitted in this order. 1. Face-to-face encounter. 2. Prior authorization approval notice. 3. Initial order for services. 4. Plan of treatment for the requested date of service with a dated signature from the supervising practitioner. 5. Order changes. 6. Visit notes in order by date of service. And 7. Other documentation needed to support the procedure code build. Note: if all of the required items are not submitted, the documents do not include a date or signature, or there is a discrepancy in the billing unit, the claim line will be fully denied. Any findings identified are preliminary until the final calculation of overpayment is determined. The provider will have the opportunity to respond to the audit and request reconsideration by submitting new or additional documentation. Now let's look at the common documentation and process errors. While conducting reviews, the medical reviewers find some common errors that can be prevented. Some of these errors are treatment plans that are not signed by the supervising practitioner in a timely manner, using incorrect modifiers when submitting billing. An example of incorrect modifier usage is when a provider submits a claim indicating that a registered nurse provided services using modifier TB, but the actual provider was a licensed practical nurse, which should be billed under the TE modifier. No dated signature of the practitioner providing home health services, such as HHA, CNA, RN, LPN, and therapy providers. Not using electronic visit verification, or EVV, to document the services rendered. Starting January 1st, 2024, in accordance with IHCP Bulletin BT 202444, federal law required home health service providers to use an electronic visit verification system to document the services rendered, and directed Medicaid programs to implement this requirement. As a note, beginning on July 1st, 2024, the IHCP turned on the EVV system edits that activate claim denials for non-compliant EVV home health services. Claims submitted on or after July 1st, 2024 that do not comply with the EVV requirement will be denied. Let's take a look at another common error that has very specific guidelines. Another common documentation error is when the claim is billed using the incorrect number of units. There are specific requirements for billing units of home health visits for therapists, home health aides, LPNs, and RNs. The guidelines for nursing visit billing are as follows. Nursing services, such as home health aide, LPN, or RN, are billed in 1-hour increments. If the nursing professional is in the home for less than 29 minutes, billing is allowed for the entire first hour only if the service was provided. For visits lasting 30 minutes or more, round up to the next whole hour. For visits lasting 29 minutes or less, round down to the previous whole hour. The guidelines for therapy visit billing are as follows. Therapy codes are billed in 15-minute increments. If a therapy visit lasts 8 minutes or longer, the provider can round up to the nearest 15-minute unit. If a visit is less than 7 minutes, no billing is allowed. Providers cannot bill for any therapy visit if the member refuses service, regardless of the time spent in the home. Now, let's wrap up.
Let's wrap up by reviewing some key takeaways about home health services. In summary, there are several key takeaways. The face-to-face encounter must relate to the member's primary need for home health services and must occur within 90 days before or 30 days after starting services. A qualified practitioner must order home health services in writing for them to be provided. All home health services require prior authorization, except as specified in the PA exception for hospital discharge section of the Home Health Services Provider Reference Manual. Home health services necessitate a written plan of treatment or care developed by a qualified practitioner, agency personnel, or therapist, and must be signed by the supervising practitioner. This plan of treatment must incorporate the essential details previously outlined in the presentation. Home health visit notes must include the patient's identity, the dated signature and position of the rendering provider, as well as the services provided, including the time in and time out. For more information on home health services, please refer to the references included in the PDF version of this presentation, which can be found on the Program Integrity website. The Program Integrity team has a provider education website where you can access additional training to keep yourself up to date on the latest information. Thank you for attending this session. If you have any questions, please email the Program Integrity email address listed here.